So, hi, Monica. So, I just want to quickly give you a chance to introduce yourself to potential clients. So, if you can first just introduce who you are and your license type, so that way clients can learn a little bit about you.
Sure. Thanks, Priscilla. So my name is Monica Hildebrand. I am a licensed professional counselor in the state of Texas.
Great. Yeah. So, as a LPC, because that's short for
Mhm.
Licensed Professional Counselor, I'm curious, what kind of clients do you normally like to work with?
Sure. I work with a variety of clients. Primarily, I have been working with individuals and couples. I also work with individuals or couples who've had trauma.
Mhm.
So it depends where they come and where they'd like to be. I would say that the majority of my time is with individuals, and it's pretty much all age groups. So I've worked with young adolescents, but in the capacity we're here, it is adults, young adults, all the way to geriatric, if that's where they're at. And then from a couple standpoint, primarily those who have been married for years, maybe kind of hitting some bumps, trying to improve communication, find new ways to resolve conflict. On the trauma side, I'm a trauma informed counselor. So I've done extensive training. And basically, what that means, it's not only the person who may have experienced trauma, but then also those family members who are with that person, whether it's a spouse or a child, so that they can learn to work within that setting, their natural setting, not where they may have been traumatized, and how do they adjust to their surroundings. And so, with the trauma, I also work with those who've had depression and anxiety,
Mhm.
maybe compassion fatigue, whatever it might be, to help them see and experience their life through a new lens, not just one that's from a trauma situation.
Yeah, yeah. And I think it's so important too, especially talking about the adjustment, because I think sometimes people can feel like, well, it's in the past, I don't really need to work on it, or that happened to my partner when they were little, doesn't really matter or affect us anymore. But we often see when working with couples or especially individuals with trauma that it definitely comes up. So finding a way to deal with it in the here and now is very helpful. So I know you mentioned, yeah, working with individuals, working with people who have experienced trauma and couples. And can you share a little bit about what kind of therapy approach you use when working with individuals, clients who have experienced trauma, and even with couples? Is it the same or is it different?
Sure. I'm kind of a hybrid. We use different words, eclectic therapist, but I'm more of a hybrid approach. It really, for me, comes out when I first start meeting with that individual or the couple and really seeing where they're at. So if they seem to be somebody who's more, thought based, or feeling based, I might take an approach of CBT, cognitive behavioral therapy. Or if there's somebody from a trauma standpoint and they're just learning to function in the day to day, it may be DBT. What are those skills that they can use to increase their tolerance? There's
Mhm.
this wonderful approach now. It's called, what's this window of tolerance? Is your window of
Mhm.
tolerance large or is it small? So
Yeah.
helping clients, whether they're individuals or couples, to increase that window of tolerance so they're not hyper aroused or hypo aroused. And
Mhm.
so with that, CBT, as I said, DBT, I do a lot of talk therapy as well. I have also, from a couple standpoint, again, a hybrid approach. I like Gottman's. I am trained in Gottman's on it's level one, and then Sue Johnson. So I like working with her emotionally focused. So it really is about meeting the couple or the individual where they're at as opposed to what I think they need.
Right, right, absolutely. And then right away, I know you mentioned CBT and DBT. Can you explain what, or just kind of say what those are?
Sure. So the CBT is basically how your thoughts and feelings impact your behavior. So if
Mhm.
you may have really negative thoughts about maybe who you are, your value, your worthiness, how do you change that lens so then it doesn't create those and those thoughts don't create behavior that isn't healthy or beneficial to living an abundant life? DBT is more of that came out of training for military. And so the idea there is if we're in a state of our mind looping around a situation, how do we move the mind, those thoughts, so you're not stuck? And so DBT can do a variety, but a lot of it may be just as simple as shifting your thoughts to something different by
Mhm.
focusing on something different. Another one is body relaxation. It could be meditation, or
Mhm.
even something like what is known as just really shocking yourself by putting your hands in cold water or
Yeah,
splashing cold water in your face.
right.
Anything to get you out of that loop.
Mhm. Good. Yeah. Thanks for explaining that. Because yeah, I know. sometimes there's just so many different like approaches and kind of backgrounds. So you mentioned CBT and DBT for individuals, Gottman and emotional focus for couples, and what about for clients who've experienced any kind of trauma?
So there's a lot of different approaches for trauma. One of the things that, and so it could be a combination of CBT, DBT,
Mhm.
but one that I've been trained in extensively is known as accelerated resolution therapy. So the idea there is that you replace distressing thoughts and images with positive images and thoughts. And so
Mhm.
you do that through a series of body sensations and checking where you're at. You find a scenario or a situation you want to address, and your brain is what does all the work. So literally by a hand movement or an eye movement, it's not EMDR, that's a different
Mhm.
modality, but this is shown to be um, very effective on a shorter term basis.
Mhm.
And so you go into that image of that thought, that situation, and then you start repainting, finding a new way to take those distressing thoughts so that you're desensitized, and you can sit here and say, okay, I can see that now, but in a different light. It's evidence based, it's been around
Mhm.
for years. So it's not hypnosis, it's nothing like that. You're fully in control.
Mhm.
It's just a different way to approach trauma.
Yeah, yeah, that's great. And I think especially for clients who experience trauma, there's this fear that am I going to get like re-traumatized or having to kind of go
Mhm.
through it all over again, which I think that's why it's so important to work with someone who's trauma informed and who has this experience like you just mentioned to where it is this like short term and it's very effective because that's
Absolutely.
very helpful and beneficial. And even if it's a individual, again, just noticing the impact that has on your couple at work, but then your family, right? Just kind of going like that little like ripple effect. So thank you so much for
Absolutely.
sharing that.
Yeah, and I appreciate I would for a distinction, it is individual therapy for ART.
Mhm.
It's never a couples approach,
Yeah,
and it is done as effectively as in person as it is virtual. So
perfect.
that as a therapist, I'm always there with the
Yeah.
client. And if their emotions are beginning to hijack them or they're getting
Mhm.
to a place it's always controlled, they're never left out being re-traumatized or
Yeah.
hanging out there.
Great, great, awesome. And then I'm curious if you can just share any um, thoughts or messages for a client who may be feeling anxious or maybe nervous about starting therapy. From many clients that we get, sometimes it's their first time. So any kind of words of advice or thoughts that you would kind of share with
Sure, sure. It's we are in a great place right now, Priscilla, where the stigma of mental health is not what it used to be.
them?
Unfortunately, through what happened with COVID and the isolation and just everything that changed, it really brought mental health to the forefront. So the good news is that there's this increased awareness across all populations, whether you are a young student, you're a young adult, to somebody who who's in their later part of life. And so, what I always encourage people to think about when they're coming is that it takes courage to be here. It takes
Mhm.
courage to want to do something different. And so, you may be feeling confused or overwhelmed, but the great thing about meeting with a therapist is it's really a relationship. It's about building that rapport, it's feeling that you're safe, that you are being heard and understood. And I'm going to encourage any person who's ever meeting with a therapist, if there's not a fit by maybe the third or fourth session, please take care of
Mhm.
you and find that fit, because there's nothing to say that you have to stay, right? You're going to find the person who's going to work with you. So, my focus in working with new clients is really helping them acquire the knowledge and the skills to make healthy changes.
Mhm.
So I really focus on what they need. It's not about me. And then how do I accompany them and journey with them to that healing and that growth so they can live a life that is abundant.
Yeah, yeah. Thank you so much, Monica. And if anyone has any questions for Monica or just about therapy in general, feel free to contact us at info@modernwellnesscounseling.com. And also, you can check out this on Monica's webpage on our website, her availability. And if you want to get scheduled with her, be sure to contact us at our phone number, which is 210-706-0392. And Monica can be open to working with you. So yeah, so thank you so much again for your time, and I hope that this was helpful for you in learning about therapy.
Thank you, Priscilla.